Hello, this is Dr. Wells with Wells Medicine, and I wanted to talk today about insurance coverage. So we don't accept insurance at Wells Medicine for several reasons. One, because we want the only decision makers to be the patient and the physician providing care to decide whether the patient needs this treatment or how much treatment the patient needs. And insurance companies tend to dictate care when they're involved in patient care. And also, a lot of insurance companies don't at this time cover ketamine infusions, or they cover it only through the process of pre-authorizations, and patients need to meet very strict criteria that not very many patients meet or are able to sustain those criteria. So for a lot of reasons, we don't take insurance at Wells Medicine, but we're happy to provide patients with what's called a super bill. So the super bill is a piece of paper or an email that describes the care that you received at Wells Medicine with things that an insurance company would recognize. So CPT codes for the diagnosis and codes for the procedures, including the office visit and the ketamine infusion. And so those codes for the diagnosis and for the procedure allow patients to seek reimbursement from their insurance companies. And we always encourage our patients to discuss with their insurance companies whether they can get partial or full reimbursement. And we've had a lot of patients, especially at self-insured companies, either have their deductibles covered or have reimbursement for their ketamine infusions using the super bill. And it really depends on your particular insurance, and that can get very complicated. A lot of patients will say, well, I have Blue Cross Blue Shield, but Blue Cross Blue Shield of Texas treats ketamine very differently than Blue Cross Blue Shield of Massachusetts. And even patients who live in Texas, if they work for a company that has Blue Cross Blue Shield of Massachusetts, may be covered by them and not Blue Cross Blue Shield of Texas. So as you can see, it can get very complicated very quickly. The other snag is that even if you have Blue Cross Blue Shield, if your company is what's called self-insured, or the company is covering the insurance costs and using the Blue Cross Blue Shield as sort of a benefits manager, those companies are much more likely to pay for out-of-network benefits, but it's up to you to discuss with the human resources manager whether or not your company is self-insured, because they don't often, it's often not part of your benefits package discussing the status of self-insured of the company. All of these make it very difficult and very complicated to know whether your insurance would cover it without having that discussion with your human resources manager and your plan benefits manager at the insurance company. It seems as though more and more insurances are trying to start covering ketamine, and there are some insurances that are now offering mental health benefits to companies separately, like Inthea. So companies can contract with these insurance companies just for mental health services and ketamine infusions. And that's happening more and more in California and Massachusetts, although it is beginning to enter the Texas market. But we're always happy to try to work with patients as best we can to help their insurances cover ketamine infusions and to try to decrease the out-of-pocket costs as much as possible. But at this time, we don't take insurance.